Thank you, Mr. Chairman. I rise in opposition to the fiscal year 2026 Labor, Health and Human Services, Education, and Related Agencies bill that we are considering today. This bill cuts a broad range of proven programs that train doctors and nurses, expand access to high-quality care, develop groundbreaking treatments and tools, prevent the spread of disease, address the overdose crisis, and keep our constituents healthy and safe. And that's just at HHS. Outside that agency, this bill also guts education job training, defunds worker protection and labor law enforcement, eliminates critical programs that support women in the workforce, and continues the Republican assault on reproductive rights. The Republican majority claims these cuts are necessary for fiscal responsibility, yet they managed to find $100 million for a new slush fund to allegedly make America healthy again. Mr. Chairman, if we actually want to make America healthy, why would we defund programs that the data shows are working? And why would we hand over our power of the purse to some slush fund run by the wildly unqualified HHS secretary? This committee should be demanding Mr. Kennedy's resignation, not bankrolling his reign of terror. Instead of solving our maternal health crisis or fulfilling Donald Trump's broken promise of IVF for all, Mr. Kennedy's primary goal seems to be taking America's healthcare backwards. He spews dangerous falsehoods about vaccines, damaging public trust in one of the most safe and effective public health tools in history. He is playing a leading role in the deadly resurgence of preventable diseases that have already killed children on his watch. In fact, while Mr. Kennedy's policies hurt us all, kids are at even more risk. He's cut CDC's lead poisoning program, their drowning prevention team, experts who study gun violence in schools, and so much more. He's using taxpayer dollars to promote junk science and allow fraudsters to profit off of the flaws in our healthcare system instead of fixing them. He's hiding information. Under his direction, the CDC has suppressed expert reports that did not align with Mr. Kennedy's ideology, including a report finding, unsurprisingly, that measles risk is high near areas with low vaccination rates. He has stripped much needed resources away from state and local public health authorities and presided over the largest cut to healthcare in our nation's history in the Big Ugly Bill. His anti-science, conspiratorial rhetoric has even fueled violent extremism that endangers his own employees, as we saw in last month's terrifying shooting at the CDC headquarters in Atlanta. One of the CDC experts who recently resigned in protest of Mr. Kennedy's dangerous policies, who served as the director of the National Center for Immunization and Respiratory Diseases, wrote in his resignation letter that Mr. Kennedy's, quote, desire to please a political base will result in death and disability for vulnerable children and adults. As a public health nurse myself, I know that this warning is true. Mr. Kennedy is unfit to serve. His leadership has been a disgrace, and he needs to resign. But unfortunately, the Trump administration's attacks on science do not end with Mr. Kennedy. The president's budget request for fiscal year 26 also took a hatchet to the National Institutes of Health, proposing to consolidate the 27 institutes and centers that make up NIH into just 8. The Eunice Kennedy Shriver National Institute of Child Health and Human Development, which supports some of the most promising work to end America's maternal health crisis, is just one of the many institutes that would be undermined by this misguided reorganization. The president's plan would also completely eliminate the National Institutes for Nursing Research and the National Institute on Minority Health and Health Disparities, firing the scientists and other staff who have dedicated their lives to ensuring every single American gets the care that they deserve. Moreover, this bill includes a funding cut that will delay and derail the cutting-edge work being done by our nation's top medical researchers. If we actually want to make America healthy, this bill makes no sense. America, I hope you're watching. I hope you're listening, because you deserve better than this bill. I certainly will not be supporting it, and I urge my colleagues in voting no. I yield back.